Welcome to Going Antiviral, the podcast for the IAS-USA, a professional continuing medical education organization focused on HIV and other viral diseases. I'm Dr. Michael Saag, professor of medicine and infectious diseases at the University of Alabama at Birmingham and volunteer member of the IAS-USA Board of Directors. Welcome to the Going Antiviral podcast. Today, March 6, 2025, we are speaking to Dr. Tonia Poteat, a professor in the Duke University School of Nursing and co-director of the Duke SGM Wellness Program. Dr. Poteat's research, teaching, and clinical practice is focused on HIV and LGBTQ health, with particular attention to the health of transgender communities. Certified as an HIV specialist by the American Academy of HIV Medicine and gender specialist by the World Professional Association for Transgender Health, she is a global leader in HIV research and care of transgender persons. Today, Dr. Poteat joins us to discuss the topic of a themed discussion session that she is leading at the CROI 2025 meeting entitled Meeting the Treatment and Prevention Needs of Transgender Women. Tonia, welcome to the podcast.
Thank you. I appreciate being invited.
Well, it's great to have you, and this is such an important topic, especially in today's world, and we'll get into that a little bit. But we realize as we look back at the 40 plus episodes that we've covered so far, topics, this is one that we have missed. So I'm really glad to have you here. Tell us a little bit more about yourself, a brief review of the path that led you to Duke and how you began to focus on transgender care.
Okay, I'll try to be brief. I have been a physician assistant, a PA, for 30 years, providing care for people living with HIV, including trans and gender diverse people. About 10, 15 years ago, I got interested in public health and research and got my PhD at Johns Hopkins, worked for a little bit for PEPFAR until I went into academia. And I've been at various places and landed at the Duke University School of Nursing about a year and a half, 2 years ago.
Okay. And tell us a little bit about the setup there, both the clinical side and the research side. How does it work at Duke?
Okay. Well, I tell people I wear both colors of blue. So my clinical work is still at UNC, at the UNC Health. And there I provide care for people living with HIV and prep for people who could benefit from that. And then my academic and research side is at the Duke University School of Nursing, where I run a lab that we call the Research in Sexual and Gender Minority Health Equity Lab, or RISE. And there's a team of people doing research.
Great. And what are the research topics that you find most interesting and what you focus on?
I mean, everything is interesting, right?
I'll withdraw the question like we're in a courtroom. You're right. What do you like to study?
I would say 90% of my research is on the health of trans and gender diverse adults. A lot of that obviously focused on HIV, but we've been expanding to include research on interventions to address mental health and well-being. That's also a risk factor for HIV, obviously, and doing some global work around accessing gender-affirming care for people at risk for living with HIV.
So let's dig into that a little bit. Let's talk about the unique challenges that transgender individuals encounter, but especially transgender women. What would you say are the top three things that you find most troubling that the patients encounter who are transgender?
Okay, so I'm a researcher, so I'm going to do like the 3 levels of the socio-ecological model.
Perfect.
Right. So
I'd say right into that.
Yeah, right. So I'd say like at the healthcare level, it's often uninformed healthcare providers who may be well-meaning, but don't have the training and information that they need to provide quality care. Then I'd say in a societal level, there's societal discrimination and interpersonal violence, family rejection, those kinds of things that we know increase risk for HIV, but also are damaging in a variety of ways. Let's see. Right now, it is legislative. For the last 4 or 5 years, we've been dealing with an increasing number of states attempting to pass laws to limit the rights of trans people. And then as of January 20th, that has been a federal objective as well. Yeah.
Well, let's break those down and dig in a little bit. So on the provision of care, um, how are you addressing that in those issues in the clinic, and uh, especially educating other clinicians about becoming knowledgeable and sensitive, for lack of a better word, to the challenges of transgender women?
Yeah, so I'm one of the clinical instructors and have been for a long time, off and on, with the Southeast Stage Training and Education Center. So I've done trainings through that venue to reach folks who work in Ryan White clinics. I'm on the planning committee for the American Conference for the Treatment of HIV. I will happily talk to any group that wants me to talk to them. And there's a growing number of people who are more than willing to provide um, education for people one-on-one. There's also online ways that people can get educated. And I'm on the board of the World Professional Association for Transgender Health, where we have guidelines.
And if we go into your learning objectives for one of those lectures and you're trying to educate, um, what are the things that you really focus on the most?
Yeah, I would say it's twofold. One is creating a welcoming environment, making sure you use the right name and pronouns so that the person feels seen and respected and has an open and honest relationship, which is, I think, a bedrock of any good clinical encounter. And then the second would be, what do you need to know about if somebody's taking gender affirming hormones, what it means for their HIV care, if there's any drug-drug interactions, things like that.
So if I'm a clinician and I've not yet encountered taking care of a transgender woman, and a transgender woman comes into my practice, what do you suggest? How do you suggest I start the encounter? What's a really good way to start asking about how she would like to be addressed, and maybe just kind of role play that with me a little bit?
Yeah. It doesn't have to be a big dramatic thing. I usually just say, hi, my name is Tonia Poteat. I use she, her pronouns. How would you like for me to refer to you?
Great, straightforward, simple, and very nurturing in a way. I love that. Okay, so moving to the education, what do you think when you're giving these lectures or people come up to you afterwards? What do you think that the clinicians struggle the most with in dealing with this?
I think some insecurity around saying the wrong thing.
Mm.
Um, honestly, I think most clinicians are good people and they want to do right by their patients, and they're worried about saying and doing the wrong thing. And I found that people, if they see that you're sincere and doing your best, that they give room for people to make mistakes.
Yeah. And moving then to the unique clinical focus, the things that you mentioned, hormone replacement therapy. Um, do you provide that yourself? Is that something you think, if someone has a reasonably large practice, well, I don't know what that would be, but let's say 5 to 10 transgender women or more, do you recommend that others engage with hormone replacement therapy? Or do you refer that to an endocrinologist? What are your recommendations to, say, the Ryan White clinics that you deal with?
Well, beautifully, there was a letter that came out a few years ago from from HRSA saying that HIV services should include gender affirming care. And if you can provide HIV care and make your way through labs and medications and follow up, then providing gender affirming care is pretty simple. There's only a few medications. They're pretty straightforward. They've been around for a long time. So I provide it myself, and I think most HIV clinicians can easily do so as well.
Right. And if somebody wants to access that, they're listening to the podcast or watching it on YouTube, website that they can pick that up from that you recall, or just reach out to HRSA for the directive? Is that?
Well, that would be nice, except we had a change of administration, so I'm not sure that is there anymore, unfortunately.
Yeah.
But there's webinars available on the AIDS Education and Training Center. There's written guidelines on the wpath.org website. It's not hard to find the information, and you can always email me. I will answer any email about this.
You are a great resource. I mean, I've heard several of your talks, and they're great, and it really has helped me a lot. So then, segueing over to the second topic, how you're dealing with stigma, discrimination, and issues involving family dynamics or personal struggles that are unique to transgender women.
So your question is, how do I manage that?
Yeah, how do you address that? And are there resources available for violence and that type of thing?
Yeah, that's a great question. I also feel like I will be remiss if I don't say that the IAS-USA also has gender affirming trainings. So I do want to mention that. But in terms of providing support for people who have experienced violence or stigma and discrimination, it can be a challenge because we sex segregate those in this country, and places are not always welcoming to transgender people. So I recommend places like the Trans Lifeline is a hotline that provides support and resources. The Trevor Project also has a hotline for young people. And I try to learn about the resources that are available in my area, so.
Yeah, and I guess it's all individual, and I'm sure like most Ryan White clinics, you have a team of people that are beyond just the clinician, advanced practice providers, but social service workers and psychologists and other folks who we can tap into on an as-needed basis to work through a lot of the challenges. And I know that's what we do at our center in Birmingham. Let's talk briefly then about the third area, and that's legislation. You're right. Historically, there have been state-by-state restrictions depending on where people live, but now there tends to be a federal adoption. And what are you seeing happening right now? You alluded to the January 20th change in administration, but how is that coming down? How's that playing out right now?
Well, in several ways. So one of the first executive orders was to suggest that transgender people do not exist, that there's no such thing as gender, and then to apply that across federal policy. And they've been applying that in ways that try to ban participation in sports, that try to ban gender-affirming care for young people, and that tell researchers like myself that our research is illegitimate and they will not fund it any longer.
Oh. So I'm sure you have grants, and are they talking about canceling those grants?
Oh, yeah. There's an article that came out in Nature just a few days ago that lists some of the people who've already had their grants canceled. So there's been at least 10 or 15 people who've already had their grants canceled. Yeah. So it's challenging, yes.
So they're scouring doing word searches for grants that have transgender in the title or gender affirmation, whatever it might be, and then they're specifically targeting those?
Yes.
And has there been any kind of organized, lack of a better word, resistance or pushback or lawsuits perhaps that are trying to block those initiatives?
Definitely. I have to say I'm very impressed with the organization of some of the progressive legal organizations that have filed lawsuit after lawsuit after lawsuit, because none of these actions are actually legal and they're not even biologically founded. You can't suggest that there's only two sexes once we know that about 2% of the population is intersex. You can't say that there's no such a thing as gender because we've all been alive. So, there's lots of pushback. It's just the court system is relatively slow.
And I'm just digging into the legal side. When you say it's illegal, I assume that's based on First Amendment rights of freedom of choice, assembly, in some ways religion, although this isn't religion per se, but people have the right to be who they are.
People have the right to be who they are, and it's not within the president's mandate to determine what kind of health care people get. That is not the role of the president of the United States, nor to determine who plays sports. Yeah. So it's just not within what the president has the right to do.
Yeah. What so those lawsuits are going on, and that's encouraging. And like you said, it's going to take a while. Have there been any stays that you know of, or pauses or blocks? A temporary restraining order, I guess, is the formal term for say the grants that have been dismissed or stopped. Ways to reinstate that in the short term. Have there been successes like that so far?
There have been temporary restraining orders on holding grants, broadly. Unfortunately, those temporary restraining orders have not been followed. So then there's been subsequent determination. So it's very challenging when there's an administration that doesn't follow the law and then doesn't follow the judicial instructions to follow the law, that make it very challenging.
Right. So I'm editor of a journal, I'm AIDS, and we're pushing forward and publishing titles and as they exist. Have you heard of researchers or people who have published papers being censored in any way, or the upcoming CROI, or you're giving a symposium? Have you gotten any pushback, feedback, not so much from the CROI organizers, but from some of your funding sources to restrict your speech?
I have not, because CROI and your journal and other journals are not federally funded. They have an amazing opportunity to provide an uncensored access to information. Unfortunately, what I have seen and what we did see for CROI is that one person that was going to participate in the theme session had to withdraw because they're a federal employee.
Wow. And their travel, they just couldn't talk about it. They just weren't allowed to attend the meeting. Okay. Well, on a more positive note, let's talk about your theme session. Tell us about it and who's presenting and what are the topics. I assume they'll be similar to what we just talked about, but I'm really curious to hear a preview.
Yeah. So, these were submitted a long time ago, so they're not topical in terms of what happens this January 20th, but I'm excited because there's 2 researchers from Brazil and 1 from France. They're going to be sharing their work. One person is going to talk about recency of HIV acquisition among trans women in Brazil. Another is going to talk about the high HIV burden in rural versus urban areas of Brazil. And another person is going to talk about how long it took to start antiretroviral therapy among trans women in France. So
some of the barriers might be access to care, getting into an HIV treatment center. I assume there's also maybe some barriers with the administration of PrEP. Is that real? Is that what's happening as well?
There are definitely barriers to PrEP. I mean, I don't know if there's going to be more sessions in the main conference than what we had room for in the theme session, but there's been a lot of really amazing work in the United States, at least, and I know also in Brazil, around increasing access to PrEP for trans women. And I think some of the newer formulations are going to really reduce a lot of those barriers, assuming there's financial access.
Right. I know that in both the cabotegravir PrEP studies and the lenacapavir PrEP studies, there were specific targets of inclusion that allowed transgender women to be studied. And so there we have data that supports its use, which is phenomenal.
Yes.
Because sometimes the studies don't focus on all the populations at risk, but these studies did, and that's going to be helpful. I know that obviously the cabotegravir is now available, but lenacapavir is coming probably in the next 3 or 4 months. We don't know exactly what the package insert will say, but I suspect it'll follow the clinical trial data and allow inclusion of transgender women among others.
Yes, absolutely.
So you all talk about that, I guess, a little bit at the symposium as well.
I'm sure it will come up. I mean, part of the idea is that we'll engage the people who come in conversations, that these talks will be like an opportunity to generate more conversation.
Right. And so your role is the convener of the symposium. Will you be presenting as part of it on your own, or but you will be managing the Q&A sessions, doing the introductions, and I'm sure that time will go by very fast. I plan to be there. It sounds like a great session. Let's focus on the next 5 years. We may have trouble getting through the next 5 weeks, but but let's think in a hopeful way. What do you see as the challenges, and how are you hoping that we get through them for women, transgender women that we're encountering in our practices?
I'd say approximately the challenge is always the same. How do we identify and meet the HIV prevention and treatment needs for transgender people? I think what we have is a new level of barriers at the federal level around getting funding. And you and I are both old enough to remember before there was federal investment in this area. And I think we're going to have to look at some of those lessons learned from that time and those strategies to be able to continue to provide as much care for people who need it as we can.
Yeah. And that research, the challenge, let's assume it gets funded. That may be a big assumption, but if it does get funded, what I think I hear you say is that we're continuing on with the vectors of studies that you've been doing at Duke and what a lot of people around the world, you mentioned France, Brazil, but I'm sure many other countries are looking at this, and hopefully that research continues and addresses the challenges and informs the clinicians on what are the best practices over time.
Absolutely.
Yeah. As I knew, our time is going by quickly. Before we close, are there any other particular topics or issues that you would like to raise that we hadn't talked about so far?
Yeah, I would just encourage people who have any heart in this area to keep going. That barriers are just another thing to move through. They are not a reason to stop. There are people who need what we have to offer in terms of HIV prevention and care, in terms of research to find the best solutions, in terms of provision of quality care. And we can keep doing that even when there's additional barriers.
I couldn't have said that better, and I applaud your work. Looking forward to your presentation at CROI, but looking perhaps even more forward to the continued contributions you make, not only in education, but in the research discovery of new approaches, and your advocacy and your encouragement to clinicians to engage in the provision of care to transgender women and others. I know is going to be sorely needed in the next couple of years, and we'll get through it. But I think it's going to require a lot of leadership, and I'm grateful for yours and for your participation today in the podcast, Tonia.
Well, thank you. I really appreciate you inviting me.
Thank you for listening to this episode of Going Antiviral. Catch up on earlier episodes wherever you listen to podcasts, and check out the video versions of this episode and others on the IAS-USA YouTube channel. You can find these links in the show notes, or simply go to YouTube and search for IAS-USA, and there they are. Be sure to subscribe, rate, and review Going Antiviral on Apple Podcasts. This podcast is for informational and educational purposes only and is not intended to serve as medical advice. Opinions expressed in this podcast do not necessarily reflect the opinions of the IAS-USA or its affiliates. If you have a question you'd like answered on the show, you can send it to podcast@iasusa.org to be answered in a future episode.